Hello friends, welcome to you all my channel Healthy Life. Friends, today I'll tell you about a very serious disease of women, that is PID. PID is pelvic inflammatory disease, which is a serious infection in your uterus, fallopian tubes or ovaries. It affects women and people assigned female at birth. PID develops when certain type of bacteria spread from your vagina to your reproductive organs. Bacteria from untreated sexually transmitted infections are the most common cause of PID. However, bacteria normally found in your vagina can also cause PID. When you have PID, you may feel pain in your lower abdomen or pelvis. You may also have unusual discharge from your vagina. Severe PID can cause permanent damage to your reproductive organs and prevent you from getting pregnant. Getting tested and treated for STIs is the best way to prevent PID. Let's know what are the most common signs or symptoms of PID. You may not realize you have PID. Symptoms might be mild or unnoticeable, but symptoms of PID can also start suddenly. They can include pain or tenderness in your stomach or lower abdomen. The most common symptoms: abnormal vaginal discharge, usually yellow or green with an unusual odor, chills or fever, nausea and vomiting, pain during sex, burning when you pee, irregular periods or having spotting or cramping throughout the month. What are the causes of pelvic inflammatory disease? Bacteria entering your reproductive tract causes pelvic inflammatory disease. These bacteria are passed from your vagina through your cervix and up into your uterus, fallopian tubes and ovaries. Normally, when bacteria enter your vagina, your cervix keeps them from spreading deeper to other reproductive organs. However, any type of infection can disrupt your cervix, preventing it from doing its job. Many types of bacteria can cause PID, but the two most common infections that causes PID are gonorrhea and chlamydia. You get both of these infections through unprotected sex. These two STIs causes about 90% of all PID cases. Less commonly, PID happens when normal bacteria gets into your reproductive organs. This can happen after childbirth, pelvic surgery, miscarriage, getting an intrauterine device. The risk is the highest in the few weeks after your provider inserts an IUD. Who's at the risk of PID? You are at the higher risk of pelvic inflammatory disease if you have a sexually transmitted infection, especially gonorrhea or chlamydia, have many sexual partners or have a partner who has had multiple partners, have had PID in the past, are sexually active and younger than 25 years, have had tubal ligation or other pelvic surgery. Let's know how is pelvic inflammatory disease diagnosed. If you feel symptoms of PID, see your healthcare provider right away. The sooner you get care, the greater your chances of successful treatment. There isn't one specific test of PID. Usually, your healthcare provider can diagnose PID through asking about your medical history, including your general health, sexual activity, and symptoms. A pelvic exam to examine your reproductive organs and feel for tenderness or abscesses. a vaginal culture to test your vaginal discharge for certain bacteria. What other tests you might need to diagnose PID? Your provider may also order for blood test, urine test to rule out a urinary tract infections which causes similar pelvic pain, ultrasound to get clear image of your reproductive system, testing for STIs. In some cases, your provider may recommend endometrial biopsy. Your provider removes a small tissue sample from your uterine lining and tests it for disease. Laparoscopy. Your provider makes small incisions in your pelvis, then inserts a lighted instrument to look more closely at your reproductive organs. What is the management or treatment of pelvic inflammatory disease? Your provider will prescribe antibiotics that you take by mouth typically for 14 days. Make sure to take all your medicine even if you start feeling better. Often, your symptoms improve before the infection goes away. Your provider may recommend you return a few days after starting the medicines. They can check that treatment is working. Some people take antibiotics and still have symptoms. If that happens, you may need to go to the hospital to receive antibiotics through an IV. You may also need IV medications if you are pregnant, have severe infections and feel very sick, have an abscess in your fallopian tubes or ovaries. You shouldn't have sex until you finish treatment. When you do have sex again, use condoms every time to prevent infections. So friends, this is all about the pelvic inflammatory disease or PID. So next time I will come with another disease or its treatment. So friends, if you haven't subscribed my channel, then please subscribe it and like the video, and if you have any question then please ask in the comment box.